WVOA.
Hey, this is Dr. Brown.
Hey, okay, yes, I need to get you on.
Okay.
All right, give
All
me
right.
just a second.
Gotcha.
Our DJ called out today, so we just getting everything
Oh,
going.
okay,
I
okay,
do
okay, okay.
apologize.
Okay, gotcha.
All right. Oh Lord, I got you, sir. I got you. And you're listening to WVOA 1590 AM as we keep it going here now. 12:15. It's time for Dr. Brown. Health Facts with Dr. Brown.
All right.
Welcome on today. Take it over.
All right. Sounds good. Thank you very much for that introduction. I greatly appreciate it. Good afternoon, listeners. You're locked into WVOE 1590 AM, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. Ooh, all right. Well, greetings, everyone. Greetings. Thank you for tuning in. Thank you for the folks listening on WVOE. Thank you for the folks listening live on Facebook, Instagram, and I think we're on Twitter as well, former Twitter. And also thank you for the people that are watching this as a recording. We appreciate all eyeballs and everyone's attention. Greatly appreciate that. So as always on Health Facts, we're always looking for something, something a little interesting to get you to know your body a little bit better, to arm you with knowledge so that you can, prevent disease and live a much healthier life. And so today is no different. So what we're going to be looking at today is April, another issue that's April awareness, and that's beating oral head and neck cancer. Okay. So we're going to talk today a little bit about something where, um, well, we're going to be talking a little bit about today about a topic that I guess doesn't really get a lot of attention, and that is oral head and neck cancer. Now, it's interesting because, one person in the United States dies from oral cancer about every hour. However, there's good news. When caught early, the survival rate can be as high as 80%. This means early detection can make all the difference in these cancers. So this month, April, is is full of important health awareness topics, and coming up between April 16th and April 22nd is Oral Head and Neck Cancer Awareness Week, and it's led by organizations like the Head and Neck Cancer Alliance and Oral Cancer Foundation. And the goal for this is simple. We want to, everybody wants to help people learn. Of course, that's what we do here on Health Facts. They want to encourage screening and want to really catch cancer early, because that's what this show is really about. Helping you to learn about different things so we can catch things early, and actually so we can really prevent disease. That's really what we want to do. Okay, and today we're going to do that thing. Great. So the things we're going to be covering today, we want you to understand, at least have a general idea of these cancers. We want you to know your risk, so whether or not you're in one of these risk categories, recognize symptoms, and most importantly, we want you to take action. Now we're about action on this show. We really want you to take action. So now, of course, we like to use our, kind of what we call plain language or things that are easily understood here. So head and neck cancers are cancers that start in the lining of your mouth and your throat. So not a brain cancer, not an eye cancer, but the areas that you use every day to talk, to eat, to swallow, to breathe. So that's the areas we're talking about here. And so if you think of it, I guess it's kind of a rough way to think of it, but the mouth and the throat are kind of like a hallway, and they're lined with soft tissues. And that soft tissue is where those cancers can start. So one of the most common type is something called squamous cell carcinoma. And that's a kind of a fancy way of saying cancer that starts in the flat surface cells, the ones you can kind of see. Squamous cells are are kind of the covering of actually skin, and then of course the lining of the mouth as well. So those are what we call squamous cell carcinomas. And these cancers typically occur in the mouth, what we call the oral cavity. So that's your lips, your tongue, your gums, inside your cheeks. And then you got areas, an area called the throat, which the scientific or medical name is called the oral pharynx. So if you ever hear that word, it's the same thing. And these are more your tonsils. So you open up the see back there, that's your tonsils. The back of the tongue, and then the soft palate. And what a palate is kind of, so your hard palate is at the top of the mouth. And then if you ever notice, like, if you go back far enough, it goes from being kind of hard and bony if you ever touch the top of your mouth, and it goes to where area where it's kind of soft. And that's what we call the soft palate. And then there are other areas as well, and that's called your voice box, so you can't really see that. Your sinuses, of course, that's kind of up here. And then what we call the salivary glands, the stuff that basically makes spit. That's what the salivary gland is. But the important thing to know about this is that these cancers are often small and painless, and that's why a lot of people miss them. Right? They're small, they're painless. It's hard to see. Nobody, you don't really check the back of your mouth every day. So of course that's where they can start out and then they can start spreading. But over time they can spread, and they especially spread to the lymph nodes and to the neck. Okay, so the lymph nodes into the neck. So that's kind of a broad view of what these cancers are, and like where they think where they occur. So now you want to, of course, you want to know who is at risk. So let's talk about numbers, but we'll keep it simple, of course. So about 60,000 Americans will be diagnosed with oral or throat cancer this year. And then when you include, all head, neck, and neck cancer, that number can go to 70,000 people. And that's enough to feel like a large sports arena. That's a lot of folks. There are towns that are smaller than this. And so about 13,000 to 16,000 people die every year of these cancers. And right now, estimates are that there are about 450,000 people in the U.S. living with it. So it's like 500,000 people living with these cancers. Now, the overall survival is about 70%. If caught early, you can get a survival of about 80% or higher. And that's the key message for today. It's like, a lot of this is prevalent. It's fairly prevalent. But if it's caught early, like I said, there's a very good survival rate for it. So now, next, of course, you want to know who's at risk. So let's be real. Anyone can get this. Anyone can get this. However, there are people that are at higher risk. So men are about twice as common as women. So twice as many men get this disease as women. So as men. Then tobacco users. So smoking, chewing tobacco, and even vaping. Yeah. You vape, the folks that vaping are not escaping a lot of this stuff. So smoking, chewing tobacco, and vaping are at higher risk. Heavy alcohol use, and especially when you combine the alcohol use with the tobacco use. Those two seem to really work what we call synergistically. So they're not just additive. So one you add one to the other, and it just simply is a little bit higher. But you add them both together, and it's a lot higher. So that is a real risk there. And then there's another thing that's coming around. There's something called HPV. Some of you may have heard of this, human papillomavirus. And what the human papillomavirus, it's a kind of cancer as well, and it's becoming one of the biggest drivers of throat cancer. And here's what's important: it's causing cancers in people who don't smoke. It's causing cancer in people who don't drink much. And it's causing cancer in people who are younger, so their 40s and 50s. And it actually is the fastest growing group of people that have these cancers. Now, the age that's most common for people to have these cancers is over 50. But like I said, it's rising in younger adults, so the 40s and 50s are getting that. Now, some other factors that can contribute are poor dental care and weak immune system. And the poor dental care, I guess the question is whether or not it's because the dentition is not good, or maybe it's because, if you're not getting dental care, there's no one to see the lesions when they're at an early stage. So bottom line for this is that it's no longer just a smoker's disease. There are a lot of other people that can get these. So now, This is where it gets really important. So, of course, this is education is not quote unquote medical advice, not specific medical advice. It's just education. But there are some symptoms that you really need to, you really need to seek someone about. Okay. So if you got a sore throat that doesn't go away, you got hoarseness or voice changes, maybe a lump, you feel around, it's a lump over here. And I don't know why I got a lump in the neck, mouth sore that doesn't heal. You got trouble swallowing. You got ear pain, especially on one side, loose teeth without a good reason. Ain't nobody hit you in the mouth, whatever. Then those are some of the symptoms you don't want to ignore. You want to have somebody take a look at. Some of these feel like a cold. They might feel like a dental issue. And that's why it's easy to ignore some of these symptoms. Okay. Now, in terms of prevention, what do we want to do? Of course, if tobacco causes it, then of course, avoiding tobacco kind of helps. You want to limit your alcohol, because the alcohol, if you're a heavy alcohol user, that's another risk factor. So you cut back or you stop alcohol. And then getting vaccinated for HPV. And the HPV vaccine protects against the strains that can cause cancer. So, and HPV right now is recommended for preteens, teens, and some young adults, kind of routinely. But for adults that are 27 to 45, talk to your doctor, talk to your NP, talk to your PA, physician assistant, and see if they think, yeah, you might be a good candidate for this vaccine. So talk to them, because this is, preventing, the infection is helpful for avoiding the cancer. So make sure you do that. The other thing you want to do is you want to make sure you see a dentist regularly, right? Because dentists catch these diseases early. They catch these cancers early. So you want to see if you can do that. Go to the dentist on a regular basis. And then you want to get screened. Like I said, during Awareness Week, April 16th to the 22nd, many places may offer some free screening. So if you see a free screening, take advantage. Okay. So now, so that's, so if the cancer is found, then of course you want to know what is the next step. And the answer is going to depend upon, where the cancer is, what stage it is, and whether it's related to HPV, i.e., whether or not they think it came from the HPV infection. So the main types of treatments are surgery. Of course, if you got a tumor, you want to take it out. So you want to do that. They might use radiation therapy, depending on what it is. You might do radiation therapy, and that's some high energy beams. Sometimes chemo. Of course, a lot of people know that with cancer you get chemotherapy, and so the chemotherapy is medicine used to kill cancer cells. And then some immunotherapy. So sometimes you use your body to help fight the cancer. They can take your body and have it target certain certain bad cells, and that's what it is. So now the good things is that early stage cancers can often be treated with just one therapy. HPV related cancers often respond better, and survival can be 80% or higher in certain cases. So all of these are very important things. So now treatment, of course, there's some challenges. Anytime that we know anything in medicine, like I said, there are good things, and then like I said, there might be some things that might be a little more challenging. And so the treatment can affect eating, speaking, swallowing. And of course, that depends upon, where it is and how involved it is. So those are some issues that you have to look out for. But a lot of times, if it does affect these things, rehab and therapy can help people recover function. So as we kind of, this is kind of a, this is not a long one like we usually do. So, but it's a very important one. So let me leave you with this. Most people who survive this cancer say one thing: I wish I had checked sooner, because many had a sore throat, a small lump, a mouth sore, and they ignored it. Because like I said, it's easy to ignore. A lot of times these things are small. So what your action plan is going to be, you're going to check your mouth. You're not going to ignore the symptoms. So the symptoms are there, you're not going to ignore them. You're going to see your dentist. Like I said, I think usually they recommend about twice a year, see your dentist. You want to talk to your doctor, and you want to get vaccinated. If you qualify for that vaccination, you want to get a vaccination. Okay. So we want you to know your body, get checked early, take action. That's what we want you to do today. That's the purpose of this. That's the purpose of this show today, is to try to decrease the number of people that get found with advanced levels of cancer, and even better, to try to prevent the number of people who get this cancer in the first place. So, less alcohol, avoid the tobacco products, and, like I said, then, like I said, the HPV, you want to do that as well. Okay. So we're going to close with a few quick questions. Okay. So number one, is this cancer preventable? Many cases are, by avoiding tobacco, getting vaccinated, less drinking, don't drink heavily. Next question, is it only older people? Before it kind of was, but now more younger people are being affected due to HPV. Should I worry about every sore throat? And not every sore throat, but if it lasts 1 or 2 weeks, if it lasts 1 or 2 weeks, yeah, you might want to get that checked out. Make sure everything's okay. Okay. And then what's the most important takeaway? And the most important takeaway is that early detection can save lives. Yes, if nothing else, early detection can save lives. Okay. So final call to action. We want to make sure that you get screened. Establish care with a doctor you trust. We're always, all our shows are going to say, hey, make sure you got a good primary care, because the primary care can get you pointed in the right direction, right? And I guess in this case, make sure you got a primary dentist, so you get your teeth, like your mouth evaluated on a regular basis. So make sure you do that as well. So as we wrap up this time, I just want to say yet again, I'm Dr. Chris Brown with Health Facts. If you found this helpful, share it with someone that you care about. Because this information really can save a life. This information, so a lot of times I do want to make sure that people listening to this understand that this information is designed not only to educate you, but also to educate people that you love, or just that you run into. So make sure that if you find this helpful, if you think it provided you some insight, that you like, follow, and share. And like I said, feel free to leave a comment. Hey, like this, great, or it's terrible. Like, find something else to talk about. Any of those things can work, right? Any of things can work. So that's kind of it. And as always, I want to let you know that this show is for educational and entertainment purposes only, not medical advice. Please consult your healthcare clinician for any specific medical advice. And of course, if you're experiencing an emergency, call 911. Okay. All right. Thank you for tuning in for our show. Thank you for everybody that's on WVOE. Thank you for everybody that's on Facebook. Thank you for everybody that's watching live. Thank you to everybody that's watching the recording. I really appreciate your time and energy. And make sure you have a healthy day. Thank you.
All right. Thank you so much for calling in.